We will start with the introduction now and then head over to the first question. So, I already have been introduced. I'm Jürgen Brandstätter, member of the IHE International Board and member of the so-called Global Deployment Coordination Committee. So, I'm part of this team who exactly have to resolve the problem. And I just told you, and we hope that we get information from you in order to make that right.
Good morning, everyone. I think I've been introduced as well. My name is Mike Nussbaum. I'm president of IHE Canada, and I'm on this panel representing the North American region. I just want to make one statement in that my expectations for this meeting have been exceeded in terms of the amount of collaboration and cooperation that we've already heard. So we'll formalize it in this panel, but I just want to congratulate everybody for their participation.
Okay, my name is Lauro Bertini. I am vendor co-chair for IHE Europe, also vendor co-chair for IHE Italy, and I represent also Delos, which is my employee. And Europe is a very established region in terms of the second time organization, and we will speak about the history of coming up of IHE Europe as an example of other regions can come together.
This is Michio Kimura, IHE Japan Vice Chair and IHE International Board. And at the same time, I'm a HL7 Japan Chair and ICTC 215 Japan Team Vice Leader. My day job is Hammonds University professor for Medical Informatics Department. And actually, I'm basically a radiologist. I started my career with doing things with diagram and learned many things about the standards. I said the day job. It's really the IHE is a night job because the international teleconference always starts 11 in the evening, 2 hours, or sometimes dead. Summertime starts from the midnight. So actually, I'm thankful for the Australian and New Zealand people. 1 or 2 hours ahead of us even.
Well, thank you for the introduction. I would like to add, it's per purpose that we have one here from the North American region, one of the European region, and one of the Asian region. So they kind of shall represent these geographical regions in this panel. And I want to reflect on Michio's remark about this, about the late TCON times. I can just confirm that, and that's one of our problems in coordinating. That's why I'm saying that in our IHE pharmacy meetings, for example, we have US guys attending, but we also have Australian guys attending. And it's really, really difficult to find TCON times where all of them can attend. So we helped ourselves with a quick fix by saying we make one TCON convenient for the Australian and one TCON convenient for the US, but that is not an optimal solution. Okay, so now we head over to the first question, which is how IHE deployment committees can support one another. I'm here on the panel for the Global Deployment Coordination Committee, and our first learning when we had our meetings, how to what shall we do, how should we do it, was in fact we know that deployment committees are quite different. There are small ones, bigger ones, there are active ones, not so active ones. There are ones which have a political board, ones who have a board of people who are interested in IHE and IHE interested, but are more on the technical side. So we see that, yes, there are so many differences and different things that our first learning was almost immediately after 15 minutes that we simply don't know how to coordinate that. The next thing is coordination has a bit of a flavor of control. Of course, we don't want to control. We know that national deployment committees are very, very stand alone. They don't want to be controlled. So that is the second thing we realized. We can't control. The only thing we can do is do helping, or to support communication between the deployment committees. And our question is now to the deployment committees actually, what do you think, what makes sense to start with? So what we, of this session, would like to get out is, what are the next concrete steps? I mean, we have made one with this World Summit, to get all the people together and talk. That's good. But we also would like to get take another step in direction. Maybe we can, don't know, release guidelines or issue this or that, which can maybe help you. But we don't know what you need. So that's what's of interest for me.
I guess I'll go next. So I'm going to take a perspective of a deployment committee, and we all here are representing deployment committees, and we all, through our deployment committees, have representation on the international board. Some are more active than others. I'm quite active, and my first comment is that I think most of us, or all of us here, really support this, really appreciate the support that the international board has reached out to us as deployment committees, asking what can the international community do to help you in a deployment committee. And so I'm going to take that perspective. I hope you all agree that that support is genuine, and it's really up to us to decide what to do with that, as Jürgen has said. The next point I want to say is, well, how do we measure success in a deployment committee? So in Canada, our perspective of success is that we have a very tight alignment with our national agenda, what we call in Canada our infrastructure, information infrastructure. And we have been, I think, fairly successful at doing that. I think that, that this has enabled IHE to have political influence at the right level. And I think we're fortunate that we are positioned to do that. Our next challenge is, well, how can we utilize that positioning to actually make change? And one of the things that this summit has reminded me is that we have to actually start building that agenda, and I'm arranging some meetings immediately following this summit to help solidify how IHE Canada can help affect and improve the Canadian infrastructure. So I think from how can deployment committees support one another, I think number one is to see if we can develop some common goals and objectives. As Jürgen mentioned, we're all different and we all have our own cultures and environments, but there are probably some things that we can share amongst one another. I think our ideology, our belief in IHE as a framework that is useful, I think that is something we can share. From the North American regional perspective, I think there's a lot of synergy between Canada and the United States. And so we need to take the lead that has been shown by IHE Europe and come together and build a strong region, and I'll come back to that later. So it's really about the IT agenda, which is policy, governance, and technology. The next point I'd like to make is that we would like to be active contributors to the international specifications. So Canadians we've been fortunate, Canadians have been involved as profile editors. We have some profile editors from Canada in this room today, and there's been many opportunities over the past few years. I think we all should do that. We should contribute. We also should avoid having to do national extensions to IHE profiles. We should take our local requirements and build those into the technical framework so that we have the ability to improve the global standards, the global specifications, not make 25 different islands of IHE specifications. And if we can accomplish that, then we can then use those specifications to help drive localized requirements through what we're calling projectathons up to now, which is other non-IHE components that are added, or orchestration of IHE components within the IHE framework. The last thing I'd like to bring forward at this point is that we all have had some examples of best practices, and our colleagues from Austria have most recently demonstrated to me that they have been able to accomplish some tremendous things in Austria, and I'm sure there's lots of other examples of that. We need to share that, and again, I'll make the pitch. We need to hear about these success stories. We need to help share those best practices amongst one another, because we, in our region, in our country, have a lot to learn from the rest of you. So we need to get very active in sharing those best practices.
Yeah, later in my discourse, I will pick up some of the elements that we have introduced. When it comes to cooperation, collaboration, the first thing that I would like to say is, well, 2 months ago we decided to have this kind of summit, and it's amazing that we all have so many people here. So that's a testimony of how much every one of us around the world is looking for cooperation, and that's probably what is needed. About talk about a little bit more this about in the closing statements. Let's talk about, for instance, one of the experiences that we have had in Europe when we decided to have IHE Europe. IHE Europe is a kind of entire deployment committee that is, there's standing between international and IHE International Board. And then the reason that we decided to have this is because we felt that the national initiative in Europe needed a glue to help them leverage one another information. And that's what happened, and that's why we were being successful in getting more and more members inside. We don't have all the members of the European Union in our organization, but we have a significant number, including Turkey, which is one of the latest additions. So that is something that was very important in 2000 when there was just IHE, not even North America, not even the United States. It was just IHE, and we started to think how to have an IHE in Europe, where the setting was so much different from the United States. We didn't have hints. We have a kind of RSNA, but it's not the same. There's a lot of fragmentation, for instance, in the user community at the time radiology level, because the local national radiology association were those that actually were making the policies. And so there was some fragmentation. We didn't have an IT representation in terms of the hospital healthcare information management thing. So, very fragmented, but still we had the feeling that we had to have an intermediate layer, which is the glue to connect all the dots from Spain to Italy and to share those best practices. In the end, it worked in sharing. And in every steering committee we have called, every steering committee call, we have every face-to-face meeting we have. There is an area specifically devoted to national initiative to tell on a monthly basis what they do, what they have achieved, what they are challenges they are facing, and so that there is question and answers, discussion about that. We do not, as IHE Europe, implement very much an action towards the national, but we can, the sharing is also a very important thing there. Okay, that's everything I want to say.
Asia Pacific region. I say North America is somewhat one market, and the European market is surprisingly one market. But still, we have very different markets: Japan, Korea, Taiwan, China, New Zealand, and Australia, and of course Singapore and India. So my feeling, I've been doing many Asian Oceanian IHE meetings in time of tens of tons of RSNA, but not so many participants are coming to present their activities. But looking at our Japan Connector Zone, we have some Taiwan vendors and of course a large Korean tax system vendors, and some Australian Japan affiliate offices coming to see. So my feeling is that Connector Zone is something like the market oriented. So who are interested, who come into the market, to that market, people come to show their products. Hong Kong. So we have to think of what are the difference between the countries and regions in our region. Let me say some delicate region. People use the word region for the European region or the Asia Pacific region, but I use the region in something like Taiwan or Hong Kong. It's a region. If we say that the country, some large country may be upset about it, so we make use of this word region, double meaning. So don't be confused. But anyway, we have to look at each country's, each region's situations. My thought is something like some countries, regions are somewhat, British Commonwealth, I mean the India, Singapore, Hong Kong, and Australia, New Zealand. And CJKT, China, Japan, Korea, Taiwan, is somewhat different because, look at the healthcare delivery system. Medical records are written in English in British Commonwealth countries. And we, in Japan, ministry is forcing us to use Japanese to make the medical record less. The same situation is enforced in Korea here. So very natural that we put emphasis on the multiple character handling. So we have to have some, additional, profiles, national extensions, and sometimes national relaxations. So anyway, we have to make it aware. We have to make it clear to others. People said to our Japan Connectathon, people from Japan say, yes, we are doing that, and very less English document coming out, and maybe people are doubtful about it, and coming to the Japan Connectathon, oh, things are doing well, they say. We visited the North America Connectathon, we visited the European Connectathons, and we are doing the same way, and we are even using the Gazelle tool to pre-test the product. So what we regret is what we can do, and what we should do is making our activities aware to others. Of course, other countries and regions, activities, deployment committees in the same large regions, or of course globally. So what I'm, as a Vice Director of the Actions in Japan, is now thinking is making more documents, more reports, more more requests for the approval of the Connectathon, more readable to all of you.
Thank you, dear panelists. I would like to give now the floor possibility to make statements.
Well, I consider myself, well, I enjoy being here, and it's my pleasure, and the amount of experience I have here these 2 days is really tremendous. I'm not really very much attached in my daily job to issues with regard to IHE and interoperability and so on. However, I contribute to this because I'm responsible for developing a lab where we will conduct projectathons and showcases and so on. But as an observer, it looks to me that IHE now is transforming. The thing I like about what IHE did in the past is that it had a very well-defined scope and very much focusing on developing these profiles and making them understood in a very clear format and so on for everybody to understand, and then convincing the community to come in and contribute and so on. when you try to move from developing the technical infrastructure into going into more collaboration, accessing more and more into the different areas, different people, and so on, then you start having complexity, and then you will have to decide how do you want to maintain your strength areas and in the same time access or have access to the more access to the collaborations or deployment committees. I believe there are two options. One is to maintain the same organization as is, maintain the success, and then develop the let me say the arm, the group that will conduct the soft, the communication, the contact with everybody else, and so on. So you don't put much load in the current structure. The other option is that you revisit your organization and make sure that you can provide sustainable information services, support, and so on to your clients, or I would say in this case the group that is working on that. All what I'm trying to say here is that I think, as an observer, IHE should maintain their strength, and when they want to move into a new mission, they should just make sure that they have approach sustainable, and then get to move into the
I think what you're saying is exactly what we learned of our strategic retreat. Our strategic retreat said basically that we are very, very happy and that we know that we have had success in development of profiles and that we have to maintain that. On the other hand, we also learned or had the common sense that the portfolio of IHE currently have is quite already very broad. We can cover a lot of use cases which are very often used. So we of course don't want to abandon the development track. We continue as it is. We know that all our efforts in supporting deployments must be in addition to that.
So my question to the panelists is about how we can use deployment committees to broaden the circle, kind of expand the tent of IHE. I think of IHE as obviously an organization of individuals, but also an organization of organizations. And part of the success of it has been in bringing in, obviously, companies, but government agencies, trade associations, and professional societies, professional organizations. And I'm wondering if you can think of ways that the deployment committees can be a vehicle for kind of drawing those kinds of groups into IHE to participate on the development side as well, because obviously the input that they as users and implementers of specifications have is critical to that process as well. I would welcome your thoughts on that question.
Let me take a stab. I have two suggestions. The first is that we have a tremendous amount of knowledge and experience in our deployment committees that we need to harness and channel back into our development communities. I think in our domains, we every cycle, every year, we ask our members of the domain committees what they think are the priorities. What we don't do, and we don't do now, and what we should do, is we should ask our deployment committees who are out there at what we call the coal phase, they're at the market, where are the demands coming from for IHE? What are we doing that we can do better, and what aren't we doing that we should be adding. I think that would be a very significant improvement to the quality in our development process. I had a second point, but I forgot. Maybe I'll come back later.
Can I comment on this one? From the other side, from the deployment side, and I for instance, for Italy, I have groups that are coming to me and say, how can we contribute to the domains? But they do see that the threshold barrier is very high in terms of time commitment, or knowledge is not a problem in itself, because what we are asking for to this organization is to come forward with a use case, which is usually their big job. So not that then someone else will take this use case and deliver integration profile assessment of the use case. So that is also something that, for instance, in that respect, traveling technical domain committees, meaning that will be helpful. I understand that you cannot have, a traveling radiology technical committee, a traveling cardiology ones. Maybe we should focus in average cabins, which are coordinated in domains in such a way that we do a week in Italy, a week in Austria, a week in Japan, which you combine multiple things. Maybe that's a possibility. So that we can also bring, because that is also, that's the other side. We haven't exploited that yet, that much. We have exploited somehow to connect it in terms of communication and bringing people and stakeholders to connect and say, and most of the time this is a wow effect. People say, wow, I haven't realized it. And one of the things that I said about the connecting, you can imagine that you wipe it out and how you cannot replace it. I mean, it's nothing in the industry that is actually doing the same job. So that's a value there, but also the domains have a value. And I think that I'm just pointing out to an example we had in Italy for the IHE meeting hosted by the consortium. I don't know how many of you were there. And also there's a one-day workshop attached. I wasn't there because shamefully I was on vacation. So, but I have to sometimes life calls. But there is the impression. I saw the program. It was impressive in terms of the content that it was able to share to people that are not yet contributors to IHE in terms of contributing to domains, but they could be in the future. And Mark was making a comment about national extension, and I'm mixed feeling about that comment. But I see, some of the reasons that he says that. But at the same time, to get where the ideal place that you were trying to figure out, you need some, some growing to be done at the national deployment level.
Our situation, what can a deployment committee can do? Education, let others see what's good in IHE. Of course, we have Australian and Korean IHE Deployment Committee, which is who already knows about it. Thanks to HIM's Asia conference doing every year, this year is going to be in Hong Kong, August. They spend some places and give us a chance to show good things about it. And been to Singapore, been to Malaysia. We've been doing what's good about it, and we are happy to go to there to show what has been our accomplishments and what we are doing fine about it. So the next thing is what we can say that we are successful about it. We are successful about it, the irregular scheduled workflows with the HL7 popularity in our country, and also the PDIs are already very popular. Almost 90% of the media exchanges by PDI in our country. So making less efforts receiving images by the healthcare providers. So all educations and awareness. We are happy to go to the neighbors to show what has been good. And after the conference, I'm very happy to say what has been banned and what should be avoided to achieve the good things.
So the next question is regional success stories. How can national deployment committees achieve greater success through the formation of a regional organization? Because we in the GDC have developed these three-tier models by saying, okay, the GDC is the overarching body, international body, but there are difficulties to communicate to all the regions, all the geographical regions, because of simple time zone problems. So our idea was to make a middle layer between this top layer and the national deployment committees and form regional committees like IHE Europe. From the IHE Austria perspective, I would say, yes, that is a good idea. I mean, we in Austria already have the experience of such an organization. Although I have to say that when I look on my own organization, I must say the primary focus, even of the board of IHE Austria, is Austria. So there are many things where we think, okay, this is important for us, and okay, we'd like to share it with others, but primarily it's important for us. So I guess maybe in other deployment committees it's the same. The willingness to spend a lot of time in preparing something for someone else is maybe not so high as it should be. So a regional organization like IHE Europe can help in a way that it shortens the way from the National Deployment Committee to the rest. Because the region usually, I mean, Europe is quite diverse, but at the end we are all European Union, and I guess we are more similar than against, for example, to Korea or to Japan. So if actually Austria has a good idea of a process, for example, we share it with IHE Europe. And that's easier than to share it with all of the rest of the world. And that's why I think that this middle layer is a good instrument, because it shortens the way to the rest and saves energy, which is anyway very rare in national deployment committees. I mean, we are all lacking of resources. So basically from an IHE Austria perspective, we are happy that we already have founded IHE Europe and that we are part of it. And additionally, IHE Europe can help in connecting to European level things. For example, as Austria deals with the Austrian things, you need someone who deals with, for example, European Commission projects, because you can't approach the European Commission as IHE Austria. It's not the right peer. So that is the second reason why I think that the regional organization as IHE Europe makes sense.
So from a North American perspective, I won't have too much to say because we don't have too much in place. But let me first commend the folks in Europe who have impressed me very much with what you've been able to do on a regional basis. I think that there are so many lessons, good lessons that have been learned there that we really need to take hold of. And so I would like to, so I am envious of you folks in Europe because you've been able to achieve this. Now, of course, you've had an EU to help with that, and you've got your trans-European projects like EPSOS to help with that. But we also have some similar opportunities in North America. We have a free trade agreement between Canada, the United States, and Mexico, which means our goods and services can pass back and forth with less tariffs. But when the Olympics were in Vancouver, the Winter Olympics were in Vancouver a number of years ago, we had an idea that we could support the healthcare needs of the U.S. Olympic team in Vancouver, in Canada, and demonstrate the interoperability of health records across the border. And we couldn't make it happen. It was a great idea, but we never got it together. So, you know, we have lots of opportunity. So let me think about what is possible. We have the only time North America is ever mentioned is in the North American Connect-a-thon. Canada has a role in the North American Connect-a-thon, albeit a very minor role. That is hosted by IHE USA primarily. It's in the USA, and Canada has a small role. But we'd like to make that a bigger role, and we've had that discussion between IHE Canada and IHE USA to work on that. So we would like to move towards more of an equal co-sponsorship of regional Connect-a-thons in North America, and that includes both shared risk and shared reward. I'm envious, again, in Europe and also in Asia Oceania, the ability to have Connect-a-thons that are coordinated and organized and moved around between the countries. I think that's great. It would be my dream to be able to have that in North America as well. I think there's a number of regional initiatives that could be shared amongst the in a regional environment, and you know, again, it's only limited by our imagination, but you know, there's lots of opportunities where we can leverage one another's strengths and try to do things together. One of the examples of that might be in the area of certification. As you all know, IHE USA is embarking on a certification program for IHE, for vendors who implement IHE profiles. Well, wouldn't it be nice if Canada also had a program that recognized the reciprocity between Canada and the US? If a vendor was certified in the US, they would automatically have certification in Canada. That would be a great goal, and I think that would be a very efficient and effective result of having this regional organization. The last point is that we have other potential IHE deployment committees in the Americas, primarily in Central and South America. We've been hearing from Brazil for a number of years about their interest in IHE, and some of us are going to the TC215 meeting, the ISO TC215 meeting in Mexico City right after this meeting, and I understand there's also some interest in Mexico. So our vision is really to, as part of the GDC planning, is to see an IHE Americas to include more of the world, and we hope to be able to provide some outreach to help encourage that.
Yeah, as IHE, well, we are very consistent in time zones. That's one of the things that we have. Of course, when we started back in 2000 about thinking about bringing IHE into Europe, we were just thinking to replicate what the US did, and trying to have, US is the size of the market in the US, the size of the by citizen, and inside the EU market by citizen was almost the same. So let's say they make a translation of that. But it was not possible, and the reason it was not possible is that we all recognize a European perspective of things. But the time was radiology, the only domain available, and most of the risk companies were not pan-European. Not even GE, Philips, and the big guys had pan-European risk products. They all had local companies doing this, barely speaking English. And by the way, we have many languages in Europe, and that is also one thing that we overcome very, very with some difficulties sometimes. But one of the things that we, as you pointed out, decided to have once we had this layer is that the travel and connect thing. That was the idea for creating a further gluing event to cement the relationship between the countries, and also to allow the local countries to be able to leverage the European level at the local level in terms of stakeholders, interest, press, and things like that. That is something that is that. Of course, what we do when we travel with the connector, we don't leverage anything in terms of technology. For instance, every time is we start from scratch, and it's a very, very complex and endeavor to organize a connectathon in a country from scratch where you cannot rely on, you do not have anticipation on the quality of the networking and things like that. So that brings also some challenges and some, challenges both from the economic side, because it will cost more, but also from the organizational side. Success stories, best practices, we tend to share this among all our members in a consistent way. Our relationship, though, with the European Commission is very light and showers. It depends. It's a very strange political animal, the European Commission. So, and it's not consistent either in terms of way to move forward. Yes, we have projects that we are participating in, and we only select projects that either are relevant to the spreading of the interoperability concept by the adoption of IHE integration profile, or to strengthen pan-European cross-border exchange. And EPSOS, it's in our history, EPSOS has been pretty much late in the game. It's just like in 2009. So, but there's been a significant step forward, and now there are other projects like the one that you all did in Antilope and the eSense, and there was some, some struggling to do in terms of keeping the European Commission and projects that are fed through their funding aware that we are neither a competitor or a threat, but we are opportunity, and we will need to help.
We have to think about AO connectors, United AO connectors, United Asian Oceanic connectors. People are dreaming of maybe some companies passing the AO connectors on, and then directly going into the China market or the India market. Of course, it's a dream, but we have to think it's a dream and very difficult to accomplish in some years. But what we can go forward to the dream, maybe two things come to my mind. One thing is visiting the European connectors on yesterday. There's a yellow shirts with the monitors walking around, and look at the baseball game now, which is one of our team is one of the best, probably. And the major league umpires are coming to the Japanese professional baseball game and the judging of the game. And in return, the Japanese Professional Baseball Association is sending some Japanese to major league. So why don't we do that? I mean, monitor each other, at least watching what's going on, and if helpful, please use the other the deployment committees monitors. I believe the hiring and assigning the monitor, recruiting the monitor may be a little bit difficult in each connector. I heard. So helping them in that way could be one step forward to that dream. One more thing is recently, last week, our October IHE Japan Connector has been approved by the international board, and we prepared some documents. People complain in Japan that why we had to make that things such a document which are formally not required in English in such a short time. I said to them, again, I say awareness of what we are doing here. We know that we are doing fine, but other people may not, from other countries, may not be visible. So we have to make it visible, aware from other department committees. So I'm very happy to see Korean and Australian and Chinese connectors on submissions, reports to see, and of course ours to be happy to be seen by the neighbors. And another step to the dream of the unified AO connectors. So we have to make one step to the dream.
Thank you, panelists. We now have 40 minutes for the floor to make comments, and so please.
Hi, there was a comment about the challenges around finding resources for the deployment community. I can tell you that some of the organizations that I hope will come and grow and join IHE in the coming number of years will be from some low resource environments where they're starting to embrace the technical frameworks. So for a country like Indonesia or Namibia or Rwanda or South Africa, this low resource problem is going to be even more pronounced. And I wonder two things. One, is there a mentoring opportunity from some of the more mature deployment committees? Two, to what extent would it be appropriate or inappropriate or difficult or easy to have a much stronger involvement of the ministries of health, for instance, in the establishment of deployment committees where they're very strongly vendor-led in many of the countries? And three, what role might, in this case, IHE Africa, for instance, play? I don't think there's one country, and only one country that would be an anchor in that. Because of the relative positions of their economies, South Africa within IHE Africa would probably end up playing an anchor role. So I don't know about traveling with the Connect-a-thon, but I appreciate just what a value that could be. I welcome some comments about this because I can tell you that for these countries, they're wondering what the role might be for a deployment committee in their country, but very much looking at what the challenges might be as well to accomplish those.
Great questions, Derek. I was hoping you'd ask them. As always. One of the roles I have on the IHE International Board currently is that I'm the liaison officer to some international initiatives such as ISO TC 215 and the Joint Initiative Council. And this is very recent, and we're just sort of developing a program for how IHE International will interact at the international level. To your point about mentoring, I think that we're already seeing some of that discussion in those forums. And I think that, and Chris and I had a discussion just the other day about how we can expand our outreach to the international community, both to the existing IHE membership and also to new and potential, most importantly, new and potential IHE members, such as we've seen from our colleagues from Saudi Arabia most recently. So I think that there is a tremendous opportunity for mentoring. I know that there are individuals within our IHE international community, like our friend Charles Parizeau, who is out mentoring all the time. And that's a wonderful thing, but we need to grow that and expand that and coordinate that. So I would like to see an initiative in our international work that we're doing at IHE to incorporate mentoring. To your point on ministries of health, I'm glad you raised that too, because we've had some dialogue during this World Summit about what we might do for the next World Summit. And one of the ideas that was brought forward, and maybe you could provide some input to this, is to have our next gathering in a place and a time where decision makers from ministries of health or other such decision makers can join us, both from an education and communication point of view, but also from some guidance as to where IHE might want to devote its resources and activities. So I think that would be, that certainly resounded with me, and we had some thoughts about how and when we might be able to do this, but very early discussions.
Other comments from the floor, please?
I'd just like to acknowledge the help we've actually had from Chris Lindon in his guise as Chris, IHE chair, so he has many roles in IHE, but essentially he's acted as our guardian angel in a sense. I don't know whether we have an official liaison from the international board to the deployment committee, but Chris is it. He sits on that board. He attends the teleconferences. We hold them at a time when he can join us from North America. When he comes out to Australia, he's certainly supported us in the technical aspects of running our showcases and connect-a-thons. And for organisations running those types of events themselves, that's critical. And he's also, in a way, become, as Charles does, an advocate for IHE. And we all know that the prophets are never accepted in their own land. An expert from overseas is always has much more credibility than anybody locally. So having someone like Chris has been helpful in terms of Chris has been able to reach out to our national programs and to our ministries in some ways that we can't ourselves because of perceived conflicts of interest with the local people and with other affiliations and so on. So it's certainly a strategy that's helped us get going in Australia, and I don't know how it would necessarily apply in other places, but certainly recommend it as a good way to build that relationship.
Yeah, the entire mentor champion thing, this is a very important thing. I think that is something that is not structured in any way, but is been vital to bringing together more countries. And there was also on WHO meeting in Geneva a lot of question of so they the countries are coming out and say, well, now we're thinking of it, but we need guidance to get to point zero. Level zero, where everything starts with emotion in the local country. To get to that place, we as an IHE community need to also have some champions and some mentors to have go there and help understand, provide some guidance. I've been doing this not as much as an extent of someone who is not here, but we mentioned many times. For instance, one of the cases was the Philippines that approached me to the WHO meeting and said, well, we are almost ready with thinking about BXPDQ, but okay, now we got to that point that we understand that is the way forward, but the last mile is the most important mile to put everything in motion in place. So there was good international board at the time. There was no GDC, acting with something. At the end of 2012, we made contact with the IHE Australia, so that was more close. I couldn't go to the Philippines, because that is not my job, and it's not in my area. IHE Europe will not pay for that because that's for the Spanish part. I don't think Philippines feels in Europe domain. So IHE Australia, start to work with them. And so that that is something that it's a very good value for us.
I'd like to recognize a few other people that I'm aware of that do a lot of this mentoring work. I'll just run down the list. So besides Charles and Chris, I'd like to recognize Eric Poiseau from IHE Europe, who travels to North America every year to support the Connect-a-thon there, and I'm sure he goes lots of other places as well. Kevin O'Donnell is a regular traveler to Japan and places in Asia, Oceania, and I know is a regular contributor in other jurisdictions. Steve Moore and Lynn Fellhofer, of course, support Connect-a-thons all around the world, and Lynn Fellhofer is here. And the last one I know about is Todd Cooper, who supports IHE Korea, I know, on a regular basis. So there is, as Lapo said, there's a tremendous amount of mentoring that's already going on. What we need to do is take this informal mentoring and perhaps build it and perhaps make it more available in more places.
Some point on the mentoring. Of course, as Michael said, formal mentoring procedures are fine, and also, let me say, especially on Asian solutions. When I explained how we wasted billions of dollars making the EHR project without precise creation standards, and as And here, Korean colleagues have my lecture. Please, would you come to our country and we're going to set the situation of the ministry decision makers and please repeat that one. So I'm very happy to go there. And hearing this one, I'm very happy. And the Singapore colleagues said, oh, that's a good thing for us. So please, again, we're going to set the same situation. Please say that in front of the ministry decision makers. So it's a informal kind of things, which seems like very effective. So formal things are good, and of course we had to have a good acquaintance between to promote this kind of somewhat under table contributions of mentoring.
We have now a few minutes for the floor. I would like to ask you, I think you have learned that in Europe and in North American regions, everyone has the opinion that this is a good thing to do something. But the Asian region is for us a bit not so known, and we have some of you here. So could you please express your opinion about forming an Asian region? Because we think always in time zones, but there are also geographical and political regions. Do you think it is reasonable to make an Asia-Oceania middle tier, or do you think it would be better to have more of you?
It's actually quite a difficult question. The time zone similarities and the trade connections between our countries would make it look sensible. China and Canada are very large trading partners with Australia, and we have good trade agreements that encourage that. However, the language barrier is quite common in that we speak none of those languages. Australians are the worst language speakers in the world, so that's really our problem. But also the differences in terms of the implementations, like the requirement of double characters in the Japanese lexicon, is a barrier. And I think that we need to discuss that, see whether we can arrive at a position where we could potentially have a shared connectathon, or at least a shared forum of some sort. But I don't think it's straightforward. And I know similar issues exist in Europe, but at least in Europe, English is sort of a lingua franca, and people are much more adept at speaking other people's languages. So you're way ahead of us in that respect. So I would like to continue that dialogue from the Australian point of view, but I think we do need to recognise that it does have significant issues that need to be addressed. Another possibility would be to have an Asia and a Pacific grouping, in that it's actually quite a long way from Australia to Japan, much further than flying across Europe or America. And we already have established relationships with our near neighbours in terms of Singapore, Malaysia, New Zealand, and we have recently initiated a dialogue with the Philippines. That is probably easier for us to look at in the shorter term, but yes, an Asian grouping in the longer term may well be something we should start looking towards.
Maybe Mr. Lee from Korea, do you have a statement to that?
Well, I totally agree with what Vincent said. In addition to that, Asian countries, as Vijay mentioned, very different health service environment and also different markets. So it's not as cooperative as in Europe countries. However, these days, many patients are traveling around from country to country. So there are some benefits having IHE Asia, but it's not as, it will not work as IHE Europe or those reasonable communities. But I think it is good to have one. We can have some way of helping each other and also communicating and sharing some information. But I don't think we can have one big market or one big company as IHE Europe or North America. That's it.
Michiel, maybe you want to make a statement to Christian?
Yes. So again, I say we have to step forward thinking about the awareness. First, awareness. Second, it's going to be a mutual help. Sending monitors, also letting others use the materials. The point is awareness to each other, acquaintance to each other. That's a key issue. And maybe if there is opportunity in RSNL would be a news, please, I say to the IHE colleagues to come to make yourself aware.
Okay, thank you for this. We now head over to the third question, which is what mechanisms would work best for the IHE Deployment Committees to interact with the development process? What stands behind this question is that we have realized that there is an open question, which is do we develop the right things? We have of course, users in our development committees, and they give input, they give use cases and all this. But we have the impression that it's also important to verify if we are really doing the right things by getting feedback from the actual national deployment committees who actually know best what is used in their countries and if there is something used and what is not used in their countries. Or maybe what is what they would like to use, but they can't use it because it's maybe too, I don't know, twisted too much in a specific direction and should be made more, I don't know, international or something like that. So the question is, what mechanisms do you think would be best to make this connection, to establish a communication channel between the national deployment committees and the development domains? Should it be done peer-to-peer directly? Should it be done within the three-tier model by the regional middle layer? In which way should it be done? Shall we invite representatives of national initiatives to development domains? Shall we open the door like this? And that is personally my personal question out of the Global Deployment Coordination Committee.
So I didn't follow the rules, and I already expressed my opinion on the need for this linkage, so I won't go on. But how to make it happen? That's a very good question. I think we need to find a mechanism, a practical way of taking input on what the deployment committees really need in their markets for our international development. So one of the things that we could perhaps do is have a forum at these world summits that draws some of that information out. Another one is direct linkages to the domain committees. I think it's early days. I'm not sure which is the best way to do that. I think there's also another avenue that we haven't talked about, but was touched on in the last panel, and that is around strategic guidance on how IHE must continually change to support ongoing healthcare reform. We heard our colleagues from Germany talk about some silos of information that those of us in North America thought, well, that's the way it used to be in the 1980s, and we don't do that anymore. And I have to be encouraged by the fact that healthcare reform, and that is the change of healthcare, the system change of healthcare, that is continually going on will someday affect our colleagues in Germany, and that they will have new policies that they have to share data across owner organizations. I hope that will finally find its way. I think health reform is a very important issue in Canada, and I know the U.S. Health reform is constantly with us. Our system is changing all the time, and we need to change with it. And I can only imagine, you expand that to the rest of the world, the level of reform that we're seeing. So we need that guidance. The last point, I think, is is around new markets for IHE, and I'm encouraged by Derek's comments of some of the developing countries that are interested in participating in IHE. IHE really is not focused on that component of the population of the world right now, maybe a little bit, but not as much as it should be. And when we have large populations with that are very, very short on resources, we need to rethink how IHE can respond. For example, much of the communications of electronic health records in places like Africa is through SMS on cell phones. Do we even think that way in our development committees? I know in ITI we don't, and we need to. So I know there's some new profiles being developed. Derek is actually a profile editor on one that is going to support this type of population, and I think that that's a great thing. So we need to embrace those new markets and encourage those new that new type of constituent of IHE.
Yeah, the market thing, it's even more important if we talk about the new possibilities and new energies that for my knowledge, that will be mostly made from low and middle income countries. That's what I see, and therefore, there are needs and systems that are different from ours, or implemented in a different way. That's probably much more politically correct. And that is something that has to be channeled back or made aware, because most of the people in the development area of IHE is made by Americans and Europeans and Japanese people. So that's one of the things there. I don't have an answer for the solution. If I had a solution out of the hat, that would be very nice, and I would put the work for the GDC in 1 second. And so I think that this kind of places that we meet like today, that's the first spark of anything that we could put together and ameliorate our process in terms of cooperation and sharing of information. That is the first point. And now we will decline what we have done these 2 days in the future months for the next coming annual or biannual or whatever it is, World Summit that will make the statement for this.
That kind of new ideas, new markets, who are going to suggest from where they are coming from? Could be, of course, the vendors which are thinking of that kind of things in the promising market, or could be, or the ministry people or the ministry advisors are planning to certain to suit to the certain situation of the healthcare delivery. So my answer is both. Of course, the deployment committees will delegate to the international board, and it could be the route, but it's not. We should not think that it is the only route to influence new ideas, because even the endoscopic domain, which Japan has a very large, dominating company. I'm kind of the Japanese. The Olympus people thought that I am going to report everything at the international board. No, I can't do it because it is too much in detail. So they are doing through their channel of approved endoscopy domains. So my answer is, of course, both doors should be open. The deployment committee delegates route, and also the deployment, or encouraging motivated vendors are going to raise the issue and make them persuaded, make others persuaded that yes, it is a standardized way. So my answer is we have to encourage both methods.
Please tell us what you think to the question how you would like to communicate with the development committees, and if that makes sense, and so on.
Thank you. Listening to what's been said over the past couple of days,
I think a theme for me that's come out, both in this and the IHE Europe meetings, is one of the need to drive adoption to a greater degree than we have been able to achieve so far. And I think it's really encouraging to hear the profile being developed to assist in adoption in developing countries. But I think that points to how I believe the development committees can actually support that adoption process. I think rather than necessarily waiting for those committees which are developing the profiles to come up with new profiles and the local committees to try and push those out into their communities, which has hitherto been the model pretty much. I think it would be perhaps useful for those people who are working on the profiles, for those people who are working at a regional or international level, to in effect push their services out to the deployment committees, to go to them and say, this is what we're doing, how does it match with what you're doing, how can we improve that process, how can we make things easier in your market, in your area, and raise the visibility of what's available for the deployment committees to support that adoption of IHE to a much greater degree. Because I think it's certainly for myself, I've been involved with IHE to some degree or other for about 8 years now, and it's only since coming to the IHE Europe meeting earlier on this week and then to the World Summit that I think I've really sort of started to appreciate the full depth of what's actually going on in the organisation. It's the other thing, if you want to know what's going on, get involved, and that's extremely true. I think about IHE, and I think that particularly where you have deployment committees that are new, or where you have people who have previously been experienced in the organisation, who've moved on and handed over the baton, so to speak, to people coming in. I think that understanding of what's available or what could be done is something that needs to be pushed out to the deployment committees more aggressively. Because I think certainly from a UK perspective, and we're obviously we're part of Europe. Obviously, Europe sort of off the other side of the channel. There's still that feeling of separate. There's still a feeling of isolation. You have to make a real effort to get involved in the goals in the IHE Europe work or processes that are going on. And I think that if we make that easy, if we have more communication from the centre and deliberate engagement from the centre to the local country organisations, then I think we have the opportunity to significantly speed up adoption across a number of different markets, a number of different countries.
So what you're basically saying is that the GDC has a deliverable, which is a communication channel from the GDC to the national deployment committees in order what is going on in the IHE organization, which committees, whatever, and invite to, as a first step, to involve them.
I think as a first step, yes, but I think we need to, I think there needs to be more action as well.
Sorry, I think as a first step, better communication down through the organisation will undoubtedly be highly valuable. But I think moving on from that, we need to look at engagement, not just communication, engagement and action focused around deployment. And I think that's the most critical thing for the probably next 5 years, in my view, for IHE.
I'd like to agree with you and also ask the question, what about education? So at this summit, we have educators from 3 regions. We have Europe, we have Canada, and we have Austria that have come together to basically provide some educational services. I know in Holland, there's an IHE Academy that's been formed, and I know there's thoughts about doing that kind of concept elsewhere in the world. Part of communications also includes awareness raising and perhaps even education. Our dream would be that IHE would be included in curriculums, for example, in educational institutions. Is that part of the suite of tools that we can deploy to help solve this issue?
No, keep going.
So that question was addressed to us generally, or?
Yeah. Well, I think it's just something to add to the mix.
Certainly, I think education is part of the process. But if you look at persuading people to include IHE concepts or IHE processes in their curricula, so for example, I'm involved in a couple of MSc programs with different education institutions in the UK. As part of my adjunct to my day job, and in order to persuade them to include IHE content in their courses, it needs to be seen to be relevant. There needs to be seen the demand in the local, in that country, and I think. It comes back to the key of driving adoption, and that's both in terms of real concrete projects on the ground and driving adoption in terms of principles at senior levels within government, senior levels within ministries of health or as such, and again, I think that's an area where bringing in experiences of the regional and international committees can be extremely helpful, because that's where there's most visibility of how that's been achieved in other countries. It's something because of history over the past 5-10 years, it's something we find very difficult to do in the UK, but we're finally making some progress. And having concrete examples to draw on, concrete experience to draw on, the ability to pull people in who've done it elsewhere, or can talk about what's happened elsewhere, into key meetings or key events, I think would be of great assistance.
Okay, Peter's next, and then Derek.
The problem of keeping up with what's going on is particularly difficult. I mean, I've tried hard, but and we have probably this so long, but knowing what's going on in the deployment committee, the various committees is difficult. I don't know whether, it may well be that there's information out there that I'm just not accessing, but a 6-monthly or 4-monthly brief report from the various committees about what they're doing, even if it's someone we're continuing to work on the prescription exchange profile, and this is what, it might be just as simple as that. At least we know that's what they're doing. If there are new work items on the agenda, we're thinking about, we've had a proposal to do this, and perhaps new work items could be in fact formally circulated to the deployment committees for as part of our process, so that we can then push them out to our membership or spheres of influence. So it may be, committees are reporting to the board, but they may in fact just be recycling some of that material and making it available.
The committees are reporting to the board once a year, and that material is all available, and we should be doing a better job of marketing the fact that it's all available. I think that will answer all of your questions.
Okay, Derek's next, and then Sunki.
Mike mentioned one of the things I'm doing this cycle is a profile co-author, and there was a gating process that we had to go through in ITI in order to be one of the profiles that's in this cycle. And both Mike and I are delegates of Canada to ISO, and one of the things that is required for new work item in ISO, there have to be 5 countries that sponsor that. And there's 36 countries, I think, in ISO, so that's, you have to get 5 of the 36. I wonder if it might be useful as a way to operationalize what was just discussed, that if you had to have 3 deployment committees sponsoring or in some way endorsing a particular work item as part of our process, then that would operationalize what is otherwise pretty amorphous. We're talking about how to find out this or that. I can tell you at an ISO meeting, it happens in the coffee lineup, that you're figuring out who's going to be backing a particular proposal, so it doesn't have to be an especially formal process, but it could very much be part of our gauging process. That if you bring a work item forward that can't get the support of 3 deployment committees, then perhaps it isn't one that should be making it into a current cycle and operationalizing.
Yeah, and they will also work the other way around. So that will also engage the National Deployment Committee to be more on the domain.
Well, I was going to suggest about the same idea, piloting from national committees. It will slow down the development process. If it slows down too much, maybe we can circulate those profiles or technical framework before publication to national committees. So that's what I was going to suggest. So he always said having 3 national committees is pretty much similar.
We have a really good process in place now where we do the profile proposals in short form, and then there's a time frame where they're presented. There's about 3 or 4 weeks. In that time frame, they could be circulated to the deployment committees for support in some kind of formalized process. So I think we could actually build that into the existing process without slowing it down too much.
Peter McCarthy, what formal processes do we have for communication? Do we have a Google group for deployment committees? Is there a LinkedIn group? Are there those sorts of channels where we can bounce out, we can put out questions to the group? Has anyone done anything like this? Or I certainly haven't been actively involved in those sort of groups. They may exist, but I just don't know about them.
Answer that. So the Global Deployment Committee Global Deployment Coordination Committee is really just information at this point. So yes, we do have a Google group list that is for the identified contact person for each national deployment committee. So that list does exist. It doesn't really get used that much right now. Most of the communications and the regular communication of IHE's kind of monthly news flash goes out, should go out to everyone. If there's anyone here who isn't receiving it, let me know and add you to that list. So anytime a profile from the domain goes out for public comment, everyone who is engaged in any committee in IHE should get an email notification of that. And then on a regular monthly basis, there's a high-level news blast that talks about things like the World Summit and ConnectCons and kind of newsworthy IHE events, as determined by the Marcom Committee, by the way. So the Marcom Committee kind of drafts the editorial calendar for those blasts. But yeah, there's a series of communication lists, Google groups for all of the committees. The domain coordination committee, so the one that goes to the co-chairs of all the domains, has been a very active committee and channel communication, including communication about profiles under development. But as we've said, we're really kind of just bootstrapping the global deployment coordination committee, and I agree that can be a channel to communicate about development activities as well as other Office of Deployment Activities. And perhaps we should talk about each deployment committee designating someone in the official role, kind of liaison, to do, as you suggest, kind of feedback information. Twitter, they talk about retweeting and sort of relaying information to appropriate people within their deployment region who may or may not be listening to or responsive to things that are going out to the more general group.
Just speaking as IHE Austria, I can confirm that these communication channels are there, and we are a well-organized committee. And however, if you have a communication line like this, you also need someone having on the other end of the line. And even within us, this is not easy to do. So I wonder if we should not make an amendment on our governance in order to request national deployment committees to name us a person which is on these communication lines. Because otherwise we send out and it doesn't reach someone. We have no time for one more comment.
And then Mike.
I was just thinking, because in the last comments I've heard a lot of coming up different new countries, developing countries into IHE. And what I was thinking of special, because there was another comment saying, okay, we have enough profiles, or they are at a very high level. And I was just thinking if we will get more of the developing countries in our organization, if you are really sure that the profiles which are existing nowadays, which out of my view are basing on a quite high technical level for more industrialized countries, if they are fitting to these developing countries too. And the next question for the development process is, how can you get the information? How does the use cases differ in these countries for the use cases you already have in IHE implemented or at least defined?
Thank you for this last comment. This is certainly very important. I hope that all those having relations to such countries help us finding the right things to this topic. By that, we have to close this panel. I thank you very much for your comments. These are very valuable for us. We will all invite you, if you want to get involved in those strategic action items, just give us a note. As said, we are an open community, and we always are happy if you have some more men to fight the battle, or women. So thank you for this. We are now going for lunch, again 1 hour, and we meet again on 2 for the closing speech and the farewell. Thank you.